Thank you for staying with us. Now, on this belt, we talk about COVID-19. Even as we all relax and get excited about the period, we must stay safe and, more importantly, stay alive. Well, we'll be hearing from a virologist, Michael Owusu, who is with the KCCR, on some COVID-19 tips, how we can safeguard our lives. Mr. Owusu, thank you so much for joining us on the AM show. Hello, Doc.
Yes, hello.
Right. Thank you for joining the conversation, Dr. Owusu. So let's just start from your take on, first of all, the relaxation of the protocols when it comes to COVID-19. Now, a lot of us can move about without even masking up. And then the call for vaccination cards to be showed at mass gatherings. Your quick reaction to that? And I premise that on the fact that we've heard from, I believe it's the GMA, on some of these developments and fears across the board.
Yeah, good morning to you, and good morning to all your viewers. So, for the call on relaxation, as at the time the president made the announcement, you will share with me that the data seem to show that the daily new cases has drastically reduced. The active cases have also reduced. So to some extent, you will expect that some of these decisions should be taken to enable people go about their normal duties and then at least get the economy running. So for such decisions made by the Ministry of Health and also announced by the President, it seems to be something that is consistent with what we have seen already as a trend in the data. But the question about protocol adherence is something that we cannot just neglect and go about our normal duties. This is because we've mentioned consistently over the period that you cannot just take out SARS-CoV-2. It's impossible to say that it is out of the system. It is a virus that is going to live with us for some years to come and possibly become a seasonal virus like many other strains that we have in the system. And because you cannot predict how this virus will be, you are better off trying to keep to these protocols, especially if you find yourself in a high-risk zone, so that you don't expose yourself to this virus, or you don't become the first target when it comes to exposure and possible transmission of this. So the protocol is something that I think we need to enforce to some extent, especially among the vaccinated populations, and also for those who are like health workers, people who are gathering at large places in churches. We have to some extent ensure that people don't just neglect this and throw it away, because you cannot predict how this virus will turn out to be. And that is the fear I have, that if you look around, it appears that people feel that it is gone.
Right.
And everything is fine. And so therefore we have to move back to what we used to do. And that is the fear some of us are entertaining, that if we begin to think like that.
Would that be a big mistake to think in that direction, especially as we've had the Kuwo, people are going to Adan, people are going to the Volta region. So people are, basically things are normal for people now.
Yeah, so if you have studied, the nature of the virus over the time, the last strain we had was Omicron. And as we speak now, the Omicron has two sublineages. One is the BA1 and BA2. Places like Canada, some part of US, South Korea, even in South Africa, they are beginning to see high transmission of the BA2 sublineage of Omicron. We don't know how this will turn out to be. And we don't also know whether this will be associated with severe disease, like we have seen previously. But some countries are beginning to record some deaths, although this is not very high. But these are things that people are watching out for. And others are calling for reintroduction of masks in certain places which already, previously have relaxed some of these measures. So, and anytime you have countries reporting of variants and strains and mutations that seem to drive waves and epidemics in their own respective jurisdictions, it tells you that, I mean, it's only a matter of time, and you also begin to experience one. It's not as if you can avoid it, but the fact is that if you are able to put in some measures, that means you can limit the impacts of it, especially in countries like this where the vaccinated population are only few, and we have not crossed the 50% mark. We have not hit expected 70% herd immunity that we thought we would get to. So because of some of these limitations, we just have to tread cautiously and balance this with what we used to do. And the fact is that I also feel that we have learned some good things through this period. The need for maintaining good hygiene, the need for using hand sanitizing, and then even masking. Masking has reduced not just SARS-CoV-2, but respiratory illness in children has drastically reduced. I mean, things like meningitis, which is also transmitted through the respiratory portal, has also reduced. Cholera has gone down because of good hygienic practices that people are adopting. And I would have wished that we carry on with these good ethics that we have learned to take us through and to help us deal with a lot of the infectious diseases that seem to kill and cause us to become sick almost every year.
Right.
So I'm a bit worried that people are eager to go back to the old lifestyle, to neglect everything, to now shake hands, to hug, to do everything that we used to do, which gave us some of these problems that we experience. So I think people must be cautious and to do things, be mindful that as we go through the Easter, we are not just out of the woods yet. The virus is still lurking around.
Right.
Predict how this will become. You can't say it is off. Because of that, you must always guard yourself and ensure that you don't put yourself or those around you.
And that precisely is why we're having this conversation, Dr. Owusu. So, I mean, we've heard from some establishments. I mean, the Ghana Catholic Bishops' Conference, for example, has said that, yes, we're doing all of these, but don't forget to wear your mask when you come for the mass gatherings and do this and that. So at least some institutions are also ensuring, or some churches are ensuring that the adherents or the faithful abide by some restrictions just to prevent a spread. But what would be your COVID-19 tips for all of us in these times, for people out there who are, well, some who are partially observing the protocols, some who are not observing the protocols at all? What would you tell all of us by way of tips?
Well, the first thing is that if you are not vaccinated, don't get yourself involved in large gatherings, or don't get to places where you want to say they are high-risk zones, because the potential of becoming infected and becoming sick is very high, or you can also transmit to those people. So vaccination is one of the key things that we will expect. And also will encourage that even for places that are organizing large parties and all that, at least they could put in vaccination as a measure, as a check, so that they will at least admit those who are vaccinated. It will help a lot to limit any possible spread and keep people safe. The second thing is that if you know you are coughing, sneezing, and not feeling well, don't also join large gatherings at places which are celebrating Easter. Just sit your home, take good care of yourself, put on your mask until you get well before you move out. And then also, if you also are an elderly person, 60 years and above, as much as possible, try to also avoid large gatherings or get to places which are classified to be high-risk zones, because those who are, the elderly people, are highly susceptible. So you want them to become exposed and to get sick. And likely, if you have children who are less than 5 years, newborns and all that, don't also get them involved in large gatherings, because you may put them also at risk. And as much as possible, use this period to also encourage people that although the measures have been relaxed, we must take our personal responsibility to at least put on the mask, to ensure that the verifical packets, hand sanitizing, are easily accessible, to hold on to the things we used to do, so that we don't put our lives and the lives of others at risk. Even in case you have these new variants coming and you have a population maintaining and keeping to these protocols, the impact will be reduced. And this is one of the objectives of undertaking some of these public health measures. It's not that you can prevent it, but then you limit the potential impact, reduce deaths, reduce hospitalizations, and to ensure that the disease does not run to the populations and cause deaths like it has done previously.
Just finally, just to top up, maybe in some 30 seconds, today is Easter Monday. A lot of people will be congregating to eat and all of that. Any specific advice for them? Touching different bowls, there'll be a lot of touching. There'll be a lot of sharing and eating. Any specific advice in that regard?
Yeah, so, well, the advice is, we have all heard and known these protocols. As much as you can, try to maintain some level of social distance as much as you can, especially if you're a vulnerable person. As much as you can, try and do it. At every opportune time where you feel you are in a large gatherings, surrounded by many people, put on your mask. And also when you have access to hand sanitizers, try and sanitize your hand intermittently. If you can avoid shaking, that is good. Hugging, it is best you don't do it. Keep to, the waving of hands like we used to do. Don't hug, don't get yourself involved in exchange of words at close proximity, so that at least you can keep yourself safe and also keep others safe.
Thank you so much, Dr. Michael Owusu. It's been great having you join the conversation this morning.
You're welcome.
Dr. Michael Owusu is a virologist with the KCCR. But in our next belt, right after the break, we're going to be looking at this. Recently, the president spoke to us and he said that, well, we're in dire times, but we should have hope of good economic times to come. Now, we ask you this morning, we're going to activate the phone lines and have you call. How have you fared within this Easter period? How has COVID-19 and these times impacted your pocket? We'd like to know that conversation up next, right here on the AM show. Do stay.